It was another record-breaking day for COVID-19 case numbers in Ohio. In the past 24 hours, nearly 20,600 new cases were reported. That breaks the previous record set on Wednesday. This week alone, Ohio had more than 100,000 new cases. In the same time span, the positivity rate jumped from 4% to 28.4%. When it comes to hospitalizations, the last 24-hour increase was below the 3-week moving average. Case numbers and hospitalizations are the key pieces of data that will show when we are heading in the right direction. The concept is called decoupling. New at 5, 10 TV's Lindsay Mills explains.
Decoupling is the trend that infectious disease experts hope to see in COVID metrics in 2022. Let's talk waves, not the ocean, but waves of COVID cases, hospitalizations, and deaths. Over 2020 and 2021, we've seen the pattern. When cases increase, we see the number of hospitalizations go up as well. And unfortunately, when there's an increase in hospitalizations, the number of deaths also goes up. Eventually, the waves peak, crest, and then the numbers decrease again. With Omicron, we're going to see more cases, but as more people get vaccines and boosters, will that be enough to ease the hospitalizations and deaths? Take the United Kingdom, for example. Over the summer, cases started to rise and another wave was upon them. But this time, with over 60% of the population vaccinated, the case wave was not followed by a similar increase in hospitalizations. While cases went up, hospitalizations didn't. Essentially, the two metrics decoupled from one another. Dr. Joe Castaldo at Ohio Health weighs in.
If you look at data in Ohio and even the national data, if you compare it to last winter, there is not the same steep as rise as hospitalizations compared to positivity numbers in the community. So if you look at the data, there appears to be a little bit of what we call decoupling. And I think moving forward in 2022, I'm very optimistic of where that future decoupling will likely go.
And Dr. Castaldo says decoupling is powered by tools like vaccines combined with treatments like monoclonal antibodies and the antiviral pills from Merck and Pfizer. In studio, Lindsay Mills, 10 TV News.
Medical experts have said those antiviral pills from Pfizer and Merck will be a game changer in the fight against COVID-19. One local doctor says they could be available in central Ohio any day now. The at-home treatments are said to prevent hospitalizations and deaths for at-risk adults who have symptomatic COVID-19. Dr. Joe Castaldo says Ohio Health will follow guidelines from the National Institutes of Health, which prioritizes people who are not vaccinated. He says this treatment is not a reason to avoid getting vaccinated.
I'm worried about people who have not yet been vaccinated, those who don't have any immunity. For those people listening to this, you should be afraid of Omicron. It is very transmissible.
Dr. Castaldo also says that they expect that the demand will far outweigh the supply when it comes to those pills. You can keep up with all of our COVID-19 coverage on our website at 10tv.com and, of course, on our free 10TV app.